gëj a dem lopitaan pour nemmeeku sa wérgu yaram
ndax xam nga sa wérgu yaram fu mu tollu
est-ce que yaa ngi bàyyi xel ci li ngay lekka
wala exercise bokk na ci li ngay sóoraale ci sa dundu pour am ci lu la leer toppaleen ñu leen di bu ne ci suñ programme health check nga xam ne lépp lu ñuy waxtaanee dina méngoo ak sa wérgu yaram.
I am Dr. Hasan Azadeh. I'm a professor at the University of the Gambia, teaching in obstetrics and gynecology, and also the clinical director of the medical health services. I've been asked to talk about in general about health and also differentiate between man's health and women's health. As women are always the priority, let's start with women's health. Women's health, it doesn't mean that a woman is not ill and does not have any sicknesses. Health is that it is a condition without any kind of mild, moderate, or severe illnesses. How can we achieve that? With the women, obviously, they go through quite a few different phases, different parts of their life. When they are just about before puberty, this is the time, the age of like 9 to 14. In those development, the women, the young girls, they start with the menstrual period. The breast is increasing, and they get a lot of psychological and mental condition, which is due to the changing of the hormone in the women. When they pass this stage, they come to the stage of beyond the puberty. And this is the one, eventually they get married and they get pregnant and having children. This is another quite important times for women. Obviously, the healthier they are, the healthier will be the pregnancy, and that depends of they have got a good care. The family is taking care of them, and when they pass this stage, they come to the stage of the time which we call it menopause. By menopause, this is the time that the menstrual period gradually reduced, and by the age of 45, 48 years of age, their menstrual period stopped. There is another phase for the women, which they go through some difficulties. Menopause problems, they are like physically, mentally, psychologically, and socially actually, because once the important hormone as estrogen has to stop, so their skin get dry, they eventually start having kind of dryness in the genital part, and one of the problems is that they eventually the sexual desire of the woman drops, and this is the problem in the marriage. About 45% of marriages at that kind of age is because of the problems of menopause. So that would be during the menopause, and after that, we call them post-menopause. We're talking about the age of 60, 65, beyond that. So in general, if the young girl and growing up to the young teenager, growing up to a young lady, and eventually end up with menstrual period. And the problem with that, the healthier they are, the survival of the life is long. good health depends on good nutrition, and good health means that having more exercise, and good health is making sure that that the women in particular do not overfeed themselves, because obesity and then overweight, they create for women from the young age, even until the age of 40, 45, 50 years of age, they create problems. They might develop hypertension, they might develop diabetes, and this can affect actually the health of the woman in particular as the woman gets pregnant, and during the pregnancy, if those kind of disease existing, that can risk for the woman themselves and for the unborn babies. So we had to make sure that during that period, the woman has got a healthy food, more exercise, and of course, the support of the family, in particular of the husband. Now, if you turn to man's health, is kind of different. Obviously, the men as the young boys, also they come in a phase of puberty where the voice change and the hormones give them some changes of the attitude. Also they do some mentally, psychologically, physically, sexually and socially changes. Obviously for the men, they don't get pregnant, so then during the younger age, also encourage them by having some sport, movement, and also if they can afford it, always a healthy food. The problem with the men is, even if they have got some, or developing some disease, they are not coming forward to the doctors and then to explain about it. This is the difference between men and women. When the women have got some kind of starting of kind of dizziness, they come forward. They come to the clinic, they get some tests done, and eventually get some treatment done. Now, by the man, when the lifestyle of the man is like heavy drinking, heavy smoking, getting put on weight, they start having some disease, as we discussed with the women, diabetes, hypertension, and liver disease, which, and such condition, the man cannot be healthy. And this also affect not only the general health of the man, there's also effect of decreasing and of the man's hormones, what we call it as testosterone, and testosterone is a man's hormone to be able to pregnant a woman. So the chances of making pregnant a woman due to these harms, it can drop. Once it drops, they end up with kind of childless. We call it male and female, in particular male infertilities. Of course, if at some stage they realize there is something wrong with them, whether men and women, in particular men, they should actually come forward. They should be concerned. I am putting too much on weight. I am my regular meals and nutrition is not correct, and I'm suffering from headache. Something eventually can indicate that the man eventually they start having a high blood pressure. What do we do? When you have these even mild symptoms, it's better to check with the clinic, to the blood pressure to be checked, to the blood level to be checked, to blood sugar to be checked, and that to see whether there is any kind of underlying disease or going on. And if you realize that you now put on weight, even if it's up to 5 and 6 and 10 kilos, that can change in your hormones, and that give you those diseases we just explained about it. So in general, the health is not having disease. The health has other conditions that they are able to look after themselves, making sure that they avoid becoming sick, make sure they avoid to those kind of harmful lifestyle of smoking, drinking. That should not really be exercise. And this is why staying healthy for themselves, for the family, for the society, for the community. Obviously, this all kind of a package of being very aware of it. So I hope you are taking those kind of advice, that you are looking after yourself, and you're making sure that at least once a year, popping in one of the clinics to the blood pressure to be checked, the blood sugar to be checked, and to get some advice of the doctors for your health. And in particular, if you're planning a family, also that you are able to eventually pregnant a woman by having your reproductive system are normal, the sperm are good enough, moving enough, healthy enough, so they're not always blaming the infertility, childless, by women. So this is definitely is a very strong advice of male to be aware of it, having a good health, as we discussed. So maturity of the woman, they started beyond the age of 14, 15. So then this is what we are emphasizing of if they want to stay healthy, they have to take those advice I have mentioned. I am on WhatsApp. The best thing to communicate with me is on WhatsApp, not to call in. I do not have time to answer any calls. And my WhatsApp, this is my Africell telephone number, which is 777-4469. Again, 777-4469. Any communication can and should come through the WhatsApp. Once you have question, once you have a comment, once you have a contribution, if you please text it to the number I have given to you. I promise that I will reply and I will answer your question. I would welcome your comment and your contribution, and this is what it makes our lives easier to communicate and such a technique of WhatsApp.